All right. Hello, my name is Mark Stasic. I'm with Romo Benefits Group, and this is Medicare 101. Just a quick introduction for someone who is new to Medicare. So what is Medicare and who is eligible? Medicare is a federal health insurance program through the U.S. government, and it is available to U.S. citizens or residents for at least the past 5 years who are over the age of 65 or under age 65 and qualified due to disability or other special circumstance. So when do I enroll? When you're new to Medicare, you're turning 65, you have what's called an initial enrollment period. This is a 7-month window that would begin 3 months prior to your birth month and end 3 months after your birth month. If you are receiving Social Security income prior to age 65, you'll automatically be enrolled in Medicare Parts A and B, which are the two components provided by the federal government. If you are not receiving Social Security or a railroad benefit, then you need to manually enroll and sign up for Social Security or sign up for Medicare, via Social Security Administration, which you can do either online, via phone, or in person. You may also have an annual enrollment period. This would be like in year 2 of Medicare, or when you reach your renewal window, which would be October 15th through December 7th each year. Any changes that you make during that AEP, or open enrollment, it's commonly called, would take effect on January 1st. And then you may also have a special enrollment period, or SEP, which would be available to you due to special circumstances like retiring or losing employer provided coverage, moving to a new service area, or being diagnosed with a chronic health condition. Most commonly, you would be signing up for Medicare during that initial enrollment period as you're turning 65. How much does Medicare cost? So these are 2023 figures, but Part A, which is your hospital insurance, which we'll get into in a moment, as long as you or a spouse have 40 quarters or 10 years of Medicare taxes that you've paid into, you will receive what's called premium-free Part A. So you wouldn't pay anything on an ongoing basis just to have Medicare Part A. If you sign up for Part B, it is your medical insurance, and that would be $164.90 per person per month, and that would be what's called the standard Part B premium. If you are receiving Social Security or a railroad benefit, then that $164.90 is going to be deducted automatically from your benefit. If you're not receiving one of those benefits, then your Part B premium by default is going to be billed to you quarterly, or you can sign up for what's called Medicare Easy Pay, which is a monthly payment available via ACH. If you are in a high income household, then you may have what's called an IRMA, or an income related monthly adjustment amount. And there's going to be an IRMA that would apply to Parts B and D, if applicable. And that IRMA is basically a surcharge, or kind of a progressive tax of sorts, that starts for individuals who on their tax return would show over $97,000 of income, or if you're married filing jointly or as a household, you would be over $194,000 on a joint return. And what they do is a 2-year look back. So for 2023, they would be looking at your 2021 tax return to see if you are subject to that IRMA or not. That IRMA reevaluation is done on an annual basis. So if you maybe something changed with your income, whether it's you're on commission and it's a variable pay, or you sold a property or something that counted as extra income for a year, and then your income drops, maybe at retirement or whatever the case may be, you can file an appeal, or just wait for your next tax return to be filed, and they would reevaluate it and take that IRMA down if your income was lower for that following year. So what is Part A? Part A is your hospital insurance. So think of this as covering inpatient items where you go to a facility, they perform a treatment, you stay for a couple of days, and you're discharged sometime in the future. That's usually going to be covered under Part A. So inpatient hospital care, skilled nursing, hospice care, home health care, those would be covered under Part A. If you just had Part A, you would have a $1,600 deductible, and that is per experience. So not, if you had multiple hospitalizations throughout the year, you could pay that number more than once. That deductible is going to cover you for a specific benefit period. So in the case of hospitalization, it may cover your first 60 days. And then if you are beyond 60 days, then you'd have a daily rate or a copay that you would pay for that hospitalization. For skilled nursing, the deductible would typically cover your first 20 days, and then you may have a daily rate beyond that. For Part B, this is your medical insurance. So think of this as outpatient items. This would be services from doctors, could be office visits, lab work, durable medical equipment, things like that, where you go to a provider, they perform a service or a treatment of some sort, and you go home. That's usually covered under Part B. So with Part B, you would have a $226 annual deductible. And again, that's not per experience. This is an annual number. So $226. And then once that $226 is met, you are responsible for 20%. Medicare pays the remaining 80% of anything beyond that deductible. And just note that there's no cap or maximum or limit on that 20%. So with original Medicare Parts A and B, those are not designed to cover everything. You can see you've got those deductibles, you've got a copay or co-insurance percentage that you're responsible for. It also doesn't cover prescription drugs or anything related to dental, vision, or hearing that's not considered medically necessary. And so that's where the private insurance options come in to give you some additional coverage and maybe will help you with those deductibles or limit some of your out-of-pocket expenses or give you access to care like the prescription drugs, dental, vision, hearing that are not normally included with just Medicare A and B. So you have two main options. The first one is Medicare Advantage, commonly called Part C. And your second option is to add a Medicare supplement, also known as Medigap, with a separate prescription drug plan. So you would do one or the other. Option one, Medicare Advantage. Option two, Medigap with a separate drug plan. So what does Medicare Advantage look like? So again, this is Part C. Medicare Advantage will include everything that's covered by original Medicare, so your coverage can't get worse by choosing an Advantage plan. And it may feature additional options like the dental, vision, hearing. It might give you an over-the-counter allowance for non-prescription medications, and you might even get a gym membership. Most Medicare Advantage plans will include prescription drug coverage. It's not required. If you maybe have a VA benefit or something else that gives you prescription drug coverage through retirement or beyond retirement, so you don't have to choose a plan that includes drug coverage, but more often than not includes prescription drug coverage. So Medicare Advantage will help just with limiting your out-of-pocket expenses. And it'll also give you a maximum out-of-pocket so that there is some kind of a cap or a limit on what you would pay for care. Most Medicare Advantage plans are going to be either an HMO, which is a health maintenance organization, or a PPO, which is a preferred provider organization. And we'll get into the differences of that in a different video. I'm not going to talk much about that today, but just be aware that when you sign up for an Advantage plan, for the most part, you're either choosing between HMO, which is a narrower network, limited access to providers, generally not much coverage outside of your home service area, or a PPO, which is broader access to care. A lot of times it'll include out-of-network coverage beyond just your regional area or your state that you live in. And then with Medicare Advantage, one of the main ideas here is it's usually going to be cheaper on a monthly basis. And you may have these co-pays or co-insurance amounts you're responsible for. The most common Medicare Advantage plans, as far as new enrollments go, most new enrollments into Advantage are going into what are called zero premium plans. So premiums as low as $0 per month. And that, of course, would be on top of your A and B plus any IRMA. So you still have to pay those A and B premiums or IRMAs as applicable, but no additional cost for most of the new Medicare Advantage plans out there. For option two here, so this is the prescription drug side, and then we'll talk about Medigap next. So you can choose either Medicare Advantage, or you can go this route and do prescription drug coverage with a separate Medicare supplement plan. So prescription drug plans or Part D coverage is designed to cover costs for medications. You will pay a monthly premium for these standalone Part D plans. And then you may have a late enrollment penalty if you choose to delay signing up for whatever reason. Maybe you're not taking any medications. You think, why do I need a drug plan if I don't have any medications? Well, you generally still want to sign up because for every month that you go without prescription drug coverage that you were eligible for it, they will assess you a permanent penalty if you do sign up in the future. So you're generally going to want to pick a drug plan whether you feel like you need one or not. With prescription drug coverage, every plan has their own drug formulary, which is a list of covered drugs, and that formulary would tell you what tier your medication falls into. Your tier would determine the cost. They also have their own different relationship with the pharmacy networks, so it can be cheaper to go to say Meijer versus Kroger, or CVS versus Walmart, or whatever pharmacy you're using. Most of them will also include the ability to do mail order pharmacy if you'd like. Part D does have different coverage phases, so I'm not going to go too far into detail on that, but just understand that your cost that you pay at the pharmacy may change throughout the year depending on what phase of coverage you're in, whether you are subject to a deductible, or you're in your initial coverage phase with a flat copay, or you enter the coverage gap, or you get into that catastrophic phase. Your costs can change throughout the year depending on what phase you're in, what provider or what plan you are on, and what pharmacy you are filling your medication. So these plans are known as Medigap plans because they fill in the gaps that are left with original Medicare. So we talked before about your Part A deductible, your Part B deductible, and then either a copay or at that 20% coinsurance. Medicare supplements will help pay for some of your deductible, copays, coinsurance, or excess charges that are not covered by original Medicare Parts A and B. Medicare supplement plans are standardized by Medicare. And what that means is if you choose, for example, if you choose a plan G and you're looking at comparing a G from one carrier like Blue Cross to a G with HAP or Humana or Aetna or whoever you're looking at, a plan G is a plan G. It's going to provide the same coverage. It might be a different cost, and there might be other differences from one provider to another, but you know that the care or the options that you're getting are standardized for a plan G with one company to another. With Medicare supplement, one of the nice features is you are not limited to a specific provider network. You would have nationwide access to care as long as the provider accepts original Medicare. So you don't have to worry about, am I on an HMO or a PPO, or am I in network, or can I go out of state, that kind of thing. If you are on a Medicare supplement and the provider that you're going to accepts original Medicare, they will accept your supplemental plan. The other, or one other, I should say, nice feature of Medicare supplement is that you don't have to worry about prior authorizations. So basically, if a doctor or provider says you need to do X, Y, and Z, you can pretty much go do what you need to do. Where on a Medicare Advantage, one of the common complaints or downsides that we would hear about is having to do with prior authorization, maybe when going like from a hospitalization to another facility for skilled nursing or rehabilitative care, that kind of thing. So you don't have to worry about those prior authorizations when you're on a Medicare supplement. Medigap plans or Medicare supplement plans, they are age-based, and so you can expect your premium to increase every year as you get older. Your costs typically are going to go up. One other thing to note is that you'd have limited coverage outside of the US. So if you are on a Medicare supplement in particular, as opposed to Medicare Advantage, you may have a little bit more coverage outside the US. But if you are on a Medicare supplement, you definitely want to consider looking at a travel medical policy for coverage outside of the US. A couple common questions. I obviously can't answer everything in about 15 minutes or less, but if you are still working when you become eligible or you're approaching Medicare age, if you work for a small group employer, which by Medicare standards means under 20 employees, you will want to sign up for Medicare Parts A and B. Just the way that Medicare coordinates with other coverage, if you're working for a small group, you do want to sign up for A and B, and at that point, it might make sense to just transition off that group plan and go to private Medicare insurance, work with an agent to figure out your actual situation. If you're working, however, for a large group employer, which would be 20 or more employees, from Medicare standards, you can delay coverage. So we would commonly see people who are working beyond age 65 sign up for Part A only, because Part A, again, has no cost in most cases, and delay your Part B because you're covered for medical and prescriptions through your group health plan. So you can certainly do that if you work for a large group employer. If you are funding an HSA or health savings account and you are approaching Medicare age, you will want to stop funding that HSA at least 6 months prior to enrolling in Medicare. And that's because Medicare can kind of retroactively effectuate your coverage up to 6 months in the past. So this would be for someone who's maybe working beyond age 65, still receiving money, whether it's from the employer or just money that they're contributing on their own to an HSA. You'll want to stop that HSA funding at least 6 months prior to your kicking on your Medicare coverage or retirement in most cases. And then just a quick note on Medicare and COBRA. Generally speaking, Medicare and COBRA just don't get along very well. So if you have an option, whether you are Medicare age and then you become eligible for COBRA, or you become eligible for COBRA and then you age into Medicare, no matter which direction you're going, just be very careful. Make sure you're doing your research and your homework, because you typically do not want to be on COBRA if you are eligible for Medicare. If you have further questions, my contact information is there. It's best to email me, mstazek@romoinsurance.com, or visit romobenefits.com/Medicare to learn more about your options. Thank you. Have a great day.